So my name is Anna Michelet, and I am presenting about the, if it's gonna work.
It is.
Oh. My CIWA Assessment and Protocol Change Project. In the room, I have my director, Mandy, my clinical coordinator, Lindsay, and then a charge nurse, Michaela. And so this is more about not the actual process itself, it's about how I came up with it. So this is a kind of like a snapshot of everything I'm gonna talk about. It's just a poster that I had to put in that kind of gives you like the background and the method that I chose. So the problem that I recognized was that we didn't have an assessment tool and that we didn't have like a protocol to measure the severity of alcohol withdrawal patients of those that were in the department greater than 4 hours. And then of course this was delaying transfer and admission rates, and then leading to progression of severity of symptoms. The goals and objectives, so goals, I wanted to utilize the CIWA scale from the inpatient department and develop a protocol for us to treat those emergency department patients that are here for greater than 4 hours. The needs were to identify a treatment of alcohol withdrawal, improve patient safety and their outcomes, and then implement a standardized assessment tool and protocol. And then historical facts were just, I didn't have actual ones, but I did actually witness a delayed transfer, actually a rejected transfer to a behavioral health department because we hadn't taken care of an alcohol withdrawal patient that were actually like, I think they were in a moderate category at that point. The research techniques, I used Google Scholar and EBSCO just to like Google or research alcohol withdrawal like scales. Education was a big thing, like how do we improve the compliance on utilizing the protocol in the assessment tool. Stuff that I included was just different statistics I found, and then exclusion was anything greater than 5 years I tried not to include. Research findings was kind of cool. What I found was like from 2006 to 2014 that alcohol related visits increased by 40%, and then alcohol related deaths and disabilities were like 7th major one. 4% of mortality rates progressed into DTs, and another cool thing was that the use of the CIWA protocol reduced the average stay, like length of stay, 1.5 days, and that saved about $160,000 in 6 months. Let's see. Oh, and another thing that I found interesting was most patients in the ER weren't treated within a 3-hour time period. So the assessment tool, if you use it within the hour, it actually improved and decreased their stay. This is just the example that I pulled from, which you can't really see that on there, but from hour, like I did a snapshot of hours, so that's the one that we did from the inpatient that I utilized down here. And then this is the protocol order set that we worked together to decide on. We started with the inpatient protocol order set and then just kind of picked out what we might need, and then the docs can add whatever they think they need as well. Planning, I just worked with IT management and then Jen, the educational instructor down here, to develop this process and plan on a rollout piece or date, and then of course just use the inpatient assessment and protocols to use as a basic. Yep. And then evaluation, the impact on nursing practice is just to understand the pathophysiological importance for early assessments, recognition, and then timely interventions to improve patient safety, and then reduce the rejected transfer and extended admission stays. Suggestions for practice was just to apply that documentation in the assessment, the protocol on patients that are boarding or in bed search for greater than 4 hours, and then reassessment and vital signs according to the score. Implementation of change is just how we rolled it out. I chose to email like a little presentation on how to go about the process and how to identify it and everything like that. This was another of kind of an easy flow chart. If you didn't have time to go through the whole packet, it just went over like who needs a CIWA scale. And that's been the most successful. Like Sam and I were talking the other day, and she had utilized that to figure out who actually needed one. This is just one of the slides of the assessment scores of like how often you need to do reassessment based on their CIWA interpretation at the top, and then that the intervention will highlight every 4 hours, but they may need to be increased based on the interpretation. But I think it all says that when you put it in there. Results. So I did a chart audit of 40 charts total, 20 of the behavioral health chief complaint, and then 20 of the substance abuse chief complaint. 13 charts of the behavioral health didn't have any CIWA assessment documentation, and 3 of those patients had reported use. We just didn't complete an assessment. And then 20 charts of the substance abuse chief complaint. 11 did not have the assessment, and then 5 patients reported use. And I think total 2 patients came in under those that did not have assessments that were like actively seizing coming in, and that was another problem that I found, was that there was no way to document like an actual assessment for those patients. And also night shift does a wonderful job at documenting them. It's all day shift that was like missing documentation, so good job. Common issues found was, of course, the inability to accurately assess the ones that are in like active seizures, incomplete patient history documentation, inconsistent timing for initial CIWA and reassessments, and then lack of assessment documentation for patients that reported alcohol use. There was actually a patient that was discharged and they had a completion CIWA assessment scale but no initial. So then they were there for 48 hours and they did report alcohol use. Future goals is just the improve my educational. I think I need to like boost up the educational piece, and I plan to with the new grads coming in. Complete a patient history to identify alcohol use, and initial scales are important, and then just utilization of the protocol and administer meds according to the score. And those are my references. Any questions?
No questions, but you did a phenomenal job getting this out. There was a lot of work I know you put into it.
Yes.
And it was a need for sure.
Yes. Thank you.